Good afternoon, folks. This afternoon's topic A discusses how people can pay for their care. This one says, title, I'm 60 and I've been diagnosed with terminal illness requiring consistent care. How am I going to pay for it? So we're gonna discuss different options for people, how they can pay for care if they need it. So here we go. Main storyline: Don, age 60, was recently diagnosed with ALS, amyotrophic lateral sclerosis. She had planned to work until 65, but her condition may limit her ability to work beyond 2 to 3 years more. The diagnosis has forced her to rethink her retirement and financial planning, especially with the need for consistent care. Financial challenges. ALS care is expensive but often requires full-time support, which can quickly deplete savings. The article explores how individuals can prepare financially for unexpected health crises, especially when retirement plans are disrupted. Okay, broader themes. The piece underscores the fragility of retirement planning when faced with sudden illness. It raises questions about healthcare affordability, long-term care options, and the emotional toll of navigating terminal illness. Responsive financial planning strategies for cases like Don's. I'd love to co-create something with you. Great question. ALS care, highly multidisciplinary, and while there's no cure yet, many interventions can improve quality of life, slow progression, and support autonomy. Here's a breakdown of the most common care options. Okay, clinical and therapeutic interventions. Neurologist-led care, central to diagnosis and ongoing management. Medications, Riluzole may prolong survival, but reducing glutamate toxicity. Okay, edrarvone shown to slow functional decline in some patients. Symptom-specific drug, e.g. baclofen or Zendyne for muscle spasticity. Rehabilitative therapies. PT remains maintains mobility, reduces discomfort, and prevents contractures. May include aquatic therapy or assistive devices. Occupational therapy adapts daily tasks and environments to preserve independence. Speech therapy supports communication and swallowing, especially with bulbar symptoms. May include AAC, augmentative and alternative communication devices. Respiratory support, non invasive ventilation, like BiPAP, used early to support breathing. Tracheotomy and mechanical ventilation, considered in advanced stages. Respiratory therapy teaches airway clearance and breathing techniques. National gastro care, nutritional and gastro care. Dietitian support prevents nutritional uh, prevents malnutrition and weight loss. Feeding tubes, which is a PEG tube, often recommended with swallowing becomes difficult. Um, Psychosocial emotional support, mental health care, counseling for depression, anxiety, and grief, support groups for patients, caregivers, and families. Palliative care focuses on comfort and dignity and holistic well being. Community based services, home health aides assist with daily living and personal care. Hospice for end of life support, often at home in the home. Caregiver training empowers family members with skills and resources. With skills and resources. Would you like to explore culturally responsive adaptations for rural or marginalized communities? Navigating ALS care, I'd love to co design something that bridges clinical insight with community wisdom. For ALS, enhancing care goes beyond clinical management. It's about preserving dignity, autonomy, and connection. Here are some additional therapies that can complement standard treatment and supports holistic well-being. Complementary uh, and integrative therapies. Massage therapy helps relieve muscle tension, improves circulation, and reduces anxiety. Acupuncture may alleviate pain, improve sleep, and support emotional regulation. Mindfulness meditation supports coping, reduces stress, and enhances emotional resilience. Music therapy facilitates expression, memory, recall, and emotional comfort, especially valuable in later stages. Cognitive and emotional support, narrative therapy, or life review helps patients reflect on legacy, meaning, and uh, identity, especially powerful in culturally adaptive formats. Art therapy offers nonverbal expression and emotional processing, particularly when speech declines. Grief counseling for both patients and caregivers to navigate anticipatory loss and external concerns. Adaptive moment and body awareness, yoga and gentle stretching tailored to ability level supports flexibility and breath control. Aquatic therapy reduces joint strain and supports movement in buoyant environment. Uh, Felix or Alexander techniques focus on body awareness and movement efficiency. Tech enhanced interventions. Eye tracking, AAC devices enable communication when speech and hand movement are impaired. Smart home adaptations, voice controlled lighting, temperature, and safety systems. Virtual reality, emerging using use in pain, distraction, legacy, storytelling, and immersive relaxation. Community and cultural engagement, peer monitoring connects newly diagnosed individuals with experienced ALS patients. Culturally adaptive support groups tailored to language, values, and caregiving norms. Spiritual care, chaplaincy, and culturally relevant uh, rituals to support external and spiritual needs. Would you like to co-design a culturally responsive ALS care framework, perhaps one that integrates legacy work, caregiver and support, and community rituals? for ritual or marginalized populations. I'd be honored to build that with you. Implementing peer monitoring effectively, especially in ALS care, requires thoughtful design, cultural sensitivity, and sustained support. Here is a framework tailored to your system level thinking and participatory approach. Care components of effective peer monitoring for ALS. Recruitment and matching. Source mentors from diverse ALS impacted communities, patients, caregivers, gene carriers. Use value based matching, align members with mentors based on cultural background and community or communication style, disease stage, and lived experiences. Include rural and representation and historical marginalized voices to ensure equity. Training and support develop in a standardized training curriculum covering okay, so that is A for you. I will be back on with B in a little bit. See everybody in a bit for B. For now, Gator Wellness, take care.